Welcome to Epic Breathing for perinatal professionals and their clientele. Let's create a base knowledge for every new mom.
I am Jeannie, and I am the owner and founder of the Happy Mama Body. I am a postpartum corrective exercise specialist. I help moms recover their bodies after birth. And so a lot of doulas and a lot of midwives refer to me, but it would be really neat if women just came to me already knowing this so that I didn't have to work so much with them on it, because it's something that definitely every perinatal professional is capable of doing. And I don't get to see women as soon as you guys do. But before I make any assumptions, Sarah, are you a midwife or a doula?
I'm a birth doula.
Great. And then Kim, tell me, are you a doula as well?
Yes, I am.
Okay. All right. So this is going to be a little bit more specific to postpartum, but I will also say that it works when women are pregnant. It's just going to be a different experience. But if they learn it while they're pregnant, then they can apply it right afterwards and then get the benefits from it then. Okay. So I'm not going to go over everything I wrote here because I don't want to bore you guys, but basically, it takes a lot of special knowledge to repair that transformation that women go through from pregnancy and birth and the lifestyle afterwards. And to make an impact on how a woman heals, it takes a tremendous amount of knowledge. And too often we are being treated by underqualified practitioners. So my belief is if we want happy, healthy children and husbands and a culture, we got to take care of mom. And I think she's the queen bee. And if she's not happy, then nobody else gets to be happy because, we're affected by emotions. But if she's happy, then everyone else gets to kind of resonate off of that. So I really want to impact women on not teaching them to be like that giving tree that so many of us mothers are, but to really impact kind of a cultural thing where it's really truly okay to take time out to care for ourselves because we are raising the future as mothers. So I know a lot of you know this, and I know that's probably why you guys do what you do. Okay, so let's going on. I'm excited that you're here. So you can make sure to have notes, make sure any distractions are kind of zipped and tucked away. And let's begin. So this breathing technique will impact how a woman heals after birth. And as one of my most influential mentors says, breathing is everything. It is our foundation for our body. So what we are going to be learning is beyond typical breathing. And I already said this, but I hope to wow you with that information. So by the end of this, you'll have a productive method for making an impact in the healing process, which is so cool, and it's a simple technique, but giving you all this background information is really going to make you want to do it. And without that background and education, you might kind of brush it off, but you'll realize through this how really, truly important this is. Okay. So as a perinatal professional, you have access to the most vulnerable time in a new mother's life, right as soon as they have their baby. And I don't get to be there during that time because often women are too tired. So if you can effectively impart this wisdom on your clients, you can reduce mothers' need for more services later. So what we'll be covering is benefits of this practice and why it's the foundation for healing postpartum bodies. Brief understanding of anatomy on breathing to understand the diaphragm as a muscle that we can exercise. The top breathing technique that tells us the most about what's going on in a woman's core system, and troubleshooting areas of the diaphragm that lack movement. And then behavioral strategies that make this practice as regular as brushing your teeth. And then number 6, all the ways that mothers can incorporate it into the exhausting 4-month postpartum period and beyond. And then just at the end, a bit about my work with mothers. So your clients will actually follow through and see results of their actions if you instill some of the behavioral stuff that I'm going to be talking about. But before we go on, let's just take a look at this. So I found this wonderful post from the Mother Doctor. And as you can see, we got lots of prenatal visits, lots of infant visits. And then under that postpartum visit is just one. So it's just not enough. And it's time to change the dynamic in healthcare for new mothers. But we know that it is hard to change the system. So that illustrates my why and my passion for why I do what I do. That first year is the hardest time in a new mom's life. And there's just basically nothing. They're left kind of to the jungle of what's out there. And there's a lot of people touting healing modalities that from people that are actually not trained. So in the meantime, because the system is hard to change, it makes our work even more valuable, and it makes this little technique even more valuable. So we are fulfilling a need where a system is kind of failing. So let's keep doing what we're doing and offering our work. I've already said this, but I rarely see women in that first area. And I really believe that this epic breathing can be the base knowledge given to every mom to heal her body after birth right away. So that's why I want to teach perinatal professionals. So breathing is everything. The impact of deep breathing is vast. It's related to tight necks and backs, the nervous system, digestion, better sleep and sex drive, you name it. My work takes breathing and directly impacts the function of the pelvic floor and core, and it works wonders. Let's talk about the primary benefits I use it for. And just remember, there are more benefits than I've listed. As you can see already, the deep breathing is worth the effort. Okay, so benefits. Breathing well. I'm going to take a sip of water. So breathing well, and I'm giving this a name. I call it directive breathing because we're changing the way the breath moves. So breathing well, directive breathing through the entire diaphragm evenly can promote healing of the pelvic floor. So it's why I start every woman with this. And two, it helps promote healing the core and creates more, not more, but just better function of the core. And it is an absolute must for any woman who has diastasis recti. So that's the split in the abs. So you can't skip this if you have diastasis recti, if you want to heal. Okay, so it will promote relaxation and stimulate the vagus nerve and aid in digestion. So we already know that breathing deeply impacts stress, but sometimes that's not enough for us to take action. So if we know kind of the components of why this is so important, I hope that it can motivate you to take action on it. Okay, number 4, it will help release tight hip flexors. So I'm going to go into why it does that in a second, but these are the benefits and these are the why. These are the reasons why I teach women how to do it, because it changes their core tremendously. Okay, so another sip of water. Anatomy of breathing. Okay, you've got the lungs that are up here above the diaphragm. And underneath that, you have the diaphragm. So this line here kind of follows the diaphragm. And underneath the diaphragm, you have the outlining of the core, and you have the rib cage around the lungs and diaphragm. And then you have the internal organs. And like I said, the core surrounding that. And then down here, you have the pelvis. And I'm going to watch the arrow. This line right here on either side is the psoas. And the psoas connect up into the back and have connective tissue into that diaphragm. And then this little heart-shaped part of the pelvis is the iliacus, and the iliacus and the psoas together are called the iliopsoas. So those are part of the hip flexors, and those tend to be really tight in women because they lose their core and they hang on those and their back muscles. So, and then of course you have the pelvic floor or pelvic bowl down here, and it just shows a couple of the muscles, but there's tons down in the pelvic floor, but it's just showing the levator ani muscle here. and then it's showing the hip, part of the hip rotators with the piriformis back in here. So those are all part of what I consider the pelvic floor, and breathing well will impact all of that. So you're starting to see it's all connected, and I'd be right in here. There's just one more muscle that is called the quadratus lumborum. Okay, so you got a visual. We don't need to remember all of that. We just kind of get a picture in our mind about the muscles that we're affecting when we breathe deeply. Okay, so here is my own art. I like drawing these things because it gets me more in touch with the muscles. So research says that getting to know a little bit of the anatomy actually impacts the healing process. So if you're able to show your clients what the diaphragm looks like, you might help them have better outcomes. Okay, so the diaphragm is shaped like a parachute. So this little drawing over here shows it as a parachute, like what it looks like if I just take it away from the ribs. I sent this picture to my sister, and she's like, "Oh, that's a big liver." She's a nurse. She knows anatomy, but people don't think about the diaphragm and how it's a muscle. And so it's like this dome-shaped parachute underneath the lungs. So this position is in its exhalation. And when we inhale, it flattens out a little bit, not completely, it's still a little dome shape, but it kind of goes like this. So that's the diaphragm. And we have the ability to exercise this muscle all day long, no matter how tired, no matter how busy, no matter how exhausted a new mother is. With a little conscious effort, she can exercise this muscle without any contraindications through deliberate conscious breathing into tight areas where the diaphragm is not moving well. So that's what this technique is about. All right, so if you guys want this sticker, I can send it to you afterwards, but a lot of my moms just we need visual reminders. So this is what I made this a sticker for. So it's funny because it's so hard to video because you guys are down here to the side, but when I look at the video, that's when I'm like eye contact, but I'm not actually looking at you. It's such a weird thing, right? So yeah, so it's hard to remember to look at that. Okay, so anywho, technology. The breathing is like a pump machine. So I'm gonna just demonstrate with my hands. This is the pelvic floor down here. This is the diaphragm. So the inhale, the pelvic floor goes down. So when we inhale, the pelvic floor goes down and stretches out. And then on the exhalation, everything pops back up. So remember when you saw the picture of the diaphragm, it was kind of pulled up. Well, the pelvic floor should be moving with the diaphragm, right? In an ideal world. So, you know, when you have a baby in between those two places, the pelvic floor doesn't get a lot of love from the diaphragm pumping, and the diaphragm stops working in its full range of motion because you have a baby in a way. So we're made for habits, and once that habit takes place in the muscle, a lot of women just don't ever go back to deep breathing, and so they end up with all this trouble in their pelvic floor because they haven't changed out of that habit that pregnancy kind of sets, you know, because once the diaphragm stops moving, women don't suddenly go, "Oh, I can breathe better. Oh, wow, that's so wonderful." To an extent that happens, but most likely they just don't, they stay in that pattern of not breathing deeply. They start breathing into their shoulders. They're not breathing down into the pelvic floor. So if you can get women doing this right away, like it will create better outcomes in healing. So they don't have to do anything on the exhalation. So women ask me all the time, "Oh, should I be pulling up and doing a Kegel on the exhalation?" No, the exhalation is kind of just should happen a natural bounce back up. But the inhale is where we kind of have to effort to get a little stretch down into the pelvic floor. And then the exhalation should kind of just bounce up in an ideal breathing pattern. Some women are in reverse patterns where they actually do the opposite of this. But We're not going to go too deep into that, but it's just another reason why women need to practice this. Okay, so let's move on. So I'm just going to go over a couple muscles that are going to be directly associated with this technique. And so the external obliques, you can see, and just feel on your body for a second. I'm going to come back. So here's my rib cage, and the external obliques are kind of like this motion connected to those lower ribs through here. Okay. And they naturally after birth tend to be weaker and tighter, you know, depending on the human being in front of you. So at first, this breathing exercise, you might not get much movement or even feeling, because these guys are locked and tight. So breathing consistently can open them back up and get them working again, and doing a little bit of massage through that side, which I'll talk a little bit more later. I'm not going to go over all the core muscles today, but I just want to point out the external obliques. Okay. And then I also want to point out the serratus, because so many of us are breathing with our shoulders lifted. So many mothers are lifting kids. They go to lift their kids and they're lifting their shoulders up. So the serratus is underneath the armpit, right? So I'm disappearing. Okay, so it's like under here. If your shoulder is lifted, you're disconnected from that muscle. You cannot turn that muscle on if your shoulder is lifted. So if you sink that shoulder down, you're going to have connection to the serratus. And the same goes for breathing. When you're breathing laterally, you want to impact this muscle. And when you're lifting, you want to keep those shoulders down so that you can have access to this muscle. The reason why this muscle is important is because it is the arm's connection to the core. So this muscle connects right into those external obliques, right into the transverse abdomen when our shoulders are dropped. We can't access that muscle when we lift our shoulders, and so many moms are lifting their shoulders. Okay, so let's move on. Okay, the psoas is the long one. The heart-shaped one around the inside of the pelvis is the iliacus. Together, those are the iliopsoas. So as you can see, those psoas go up the back and they connect right into that diaphragm. So they will impact relaxation in the hip flexors. Every mom that I've ever seen has a really, really tight iliopsoas. I often have to send them to get deep body work for moms that just can't release them on their own. I do like a lot of self-release for these, but sometimes you just need someone to go in that does that. Okay, so breathing impacts all of our muscles. What I am teaching is teaching you how to change how breathing impacts muscles. So we breathe all day long, but we're not really, if we direct the breath, we can change how the breath impacts the muscles. So we don't want if the shoulders are moving up and down, right? You're going to impact the neck muscles. You're going to get these muscles tightening, because technically they're getting over-exercised because they're doing this all day long. Okay, so we want the breath to go down, out through the sides, and go deep enough to relax and gently stretch the pelvic floor. I'm going to be doing a video on the technique soon, so don't worry that you don't have to understand all of it. Okay, we want the breath to be open, not closed. Open means the diaphragm can move in its full range of motion. So that diaphragm is a muscle, and like any other muscle in the body, you want it to move in its full range of motion. Okay, it's healing for everyone, but directive breathing is especially impactful when healing after birth, because it heals the tissue and the muscles that were most transformed from bringing a human into this world, right? Okay, so now listen carefully on this part, because this is the hardest part to change when you're trying to change it. The front of our bellies are all stretched out from the growth of the baby. So that is the tissue area that is most open. It's, it's trying to shift. It will slowly shift back, but because it's very open, that tissue is like very movable, right? Because it's just trying to pull back, but it hasn't yet. That's the space where the internal organs will push out. It's So we know that the diaphragm is above those internal organs because the rib cage is more open. So our rib cage is more open, right? So that's going to be, instead of being kind of closed back here, the rib cage is now open, right? So instead of being here where we were pre-birth, it is now more open. And then this tissue is all open. So that's where the breath is going to go. So in this technique, we're going to be teaching them how to breathe back through the back of the body and through tight places. Another reason to do this is we really need to be sure that women can shift their breathing if a woman is bearing down when she breathes. So if you're not getting that side lateral movement and you're breathing really hard down, like you take a big breath in and you're just kind of bearing down on the pelvic floor, that can create prolapse. Or if a woman already has prolapse, it can kind of promote that dropping of everything. So we really want to get that stretch outward, because someone who's doing that probably isn't getting much movement to the side. All right, so I've talked a lot. Thanks for listening. We're going to go into the technique. And I'm just going to play a video here. And my voice is going to get a break.
Hi, I'm Jeannie Wright, and welcome to my work, helping mothers recover from birth, pregnancy, and the lifestyle afterwards. So when you're pregnant, your diaphragm stops moving in its full range of motion because there was a baby there. What is your diaphragm? Your diaphragm is the muscle that sits underneath your rib cage. And when you inhale, it goes down. When you exhale, it goes back up. Okay. So a lot of us are taught to belly breathe, to put our hands on our belly and breathe into our belly. Well, because that core tissue in the belly got so stretched out, we want to reduce the stress that is on that belly. So the first thing we're going to do is teach you how to breathe laterally. So you do that by placing your hands on the sides of your ribs, and then you inhale, and you get that nice movement out. Okay? So try that a couple times. Breathe in. Your hands are on the lower ribs. Thumbs are to your back. And you're breathing and you're feeling those ribs move out. Okay, so a lot of you are probably really tight, so maybe you're not getting that much movement. Eventually, we really want those muscles to expand and come back in. Inhale, expand, and then come back in. So if you can even just improve the movement today, that's really good. You're going to want to practice that like 40 times a day. Okay. So next, we want to breathe into our back muscles. So if you think about the ribs and you think about the diaphragm, you want to think about both of them opening up like an umbrella. So you're getting this 360-degree movement. Okay, well, because we had a baby, all of that pressure is going forward to our belly and forward from the front of the ribs being more open and from our ribs getting out of alignment. We'll go into that later, but just know that your breath is moving forward and it's putting undue pressure on your core tissue. And we want to reduce that. So after you get the lateral breath, you want to just check to see if you're getting movement into the back of your back. So I'm going to turn around and I'm going to show you. So just a little bit of movement. So just a little bit of movement, like tiny bit. It's subtle. So you can.
I'm going to pause right there because you guys are dealing with pregnant women. That is the only place that a woman can breathe well. Like if you were going to apply this technique to somebody who is pregnant, that's the area where you would want them to feel it. And they can reduce back pain significantly if they practice this regularly, just by breathing into that back space, because they're not going to be able to feel the breath forward. They're not going to be able to feel it down into the pelvic floor, but they can feel it into that back space.
Practice it at the same time that you're practicing the lateral breath, but just check in with your thumbs. Your thumbs are near your spine and just check that there's just a little bit of movement. If you're not getting any movement, that's normal at first. You might just be really, really tight. We're going to troubleshoot in the next video to release the back muscles so that they can start to move. Okay, so last but not least, we want to get our breath down into our pelvic floor, okay? So for this one, you have to get a little quieter. a little bit more in tune with your kinesthetic process, which means that mind-body connection. So close your eyes, take your hands to the sides of your ribs, and breathe in big and long. So you're breathing laterally, but you're breathing in longer than you normally would. And you're just feeling for the most subtle movement down of your pelvic floor. So here's the diaphragm, here's the pelvic floor. When you inhale, they move down together. That stretches the pelvic floor, okay? And then the move on the exhalation, that moves back up. This is the ideal. Inhale down, exhale up. Many of you are going to have a reverse process, and many of you are not breathing in deep enough. So your pelvic floor is not getting that motion that it needs all day long. Okay, so close your eyes, take your hands to the sides, breathe in as long as you can, and feel the breath go into the sides of the ribs, into the back, and into the pelvic floor. Do that 40 times a day, and then go to the next video for troubleshooting so that you can open and expand your breath even more, and so that it can become easier. All right, ask me questions. I'm here for you. I'm looking forward to all the healing benefits you're going to get from this breath.
Okay. So that's part of my online program, but so we're not going to any next video, but I'm just going to talk about the next part. So troubleshooting.
Jeannie?
Yes, please.
I have a question before you go on. With the exhale, are you exhaling out of your mouth or out of your nose?
I always like to breathe in and out through my nose,
Okay.
except for when you're doing a particular breathing technique.
Uh-huh.
Because we have a lot of protective mechanisms in our nose that we don't have through our mouth. And mouth breathing, some people have a really hard time not mouth breathing, but mouth breathing can lead to a lot of health issues. Like, and some people that might have trouble with it might have sleep apnea. So always through in and out through the nose. However, that said, if it's helpful as a technique to give a little force out through the mouth, absolutely try it out. I feel like exploring with the breath, exploring with sounds is really helpful. When I have people do core exercises, I have them breathe out through an invisible straw because it's going to give them a better and stronger contraction on the exhalation. So they can absolutely, as a technique, give a little force and see how their body reacts. But in general, in like the bigger picture of the day, in and out through the nose.
Okay, thank you.
You're welcome. That's a great question. Okay, so let's go on to troubleshooting. I almost always have women lay with the pillow on their side. So they're laying down on their side. And that way I can really, really look at what the left one-sided rib is doing. So they're laying on their side, and then you can really have them put the hand there and just watch their breath on the side. And that's something you can do with pregnant women too. And if they're getting some movement on one side, but not the other, it's really important to have them try to breathe into the side that they're not getting movement in, because the longer they go getting only one-sided breathing, the more their core is going to be functioning different. So because side to side core stuff is one of the biggest stuff, the biggest things that I deal with, so that they're working from a place of stability. Because if you don't have both sides of the core working together, you're going to be a lot more unstable in your body. And with diastasis, it's almost always an issue. You're going to be more prone to diastasis, more prone to prolapse, more prone to pelvic floor stuff if you're not getting that even breath from side to side. Okay, so I hope that motivates you. So you go on one side, see how one side is moving, go on the other side, see how the other side is moving. They might not notice a difference. You might not notice a difference because maybe it's subtle. In which case, don't worry about it. Just see what they feel. Okay, and then the next thing is because the shoulder is lifting. So I don't know, do you guys ever feel your shoulders lift when you breathe? You're doing that shallow breathing. Yeah, so, okay. So putting your hands, I'm gonna lower this down and show you. So I have It's hard with the virtual background, but let's see. Okay, so I'm disappearing. Okay, I thought this was fun, but okay. Anyways, you put your elbows down on a chair. See how much lower my shoulders go? So when you use something like this, it's called biofeedback. So the chair becomes biofeedback. So now I got my elbows dropped down to the arms of my chair, and then I'm going to close my eyes and I'm going to breathe out through the ribs down into my pelvic floor. And the experience should shift a little bit because I'm able to drop that breath down a little bit better. Mm-hmm. Another thing you can do is just put your hands on someone's shoulders and just making sure that their shoulders are dropping. Okay. So another thing that is very common to do is to use some kind of band. This is a TheraBand. It's my favorite, but you can use any strap. You can use a scarf. You can use a towel. And you wrap it around your lower ribs so that it's another way to get biofeedback. So you wrap it around your back and then you hold it with one hand and you hold it tight. So now, a lot of women are going to be breathing and it's just going to all go out through here. So see that hand movement? That's what you want to avoid. You want them to stretch the breath into the back of the band. And so now when I breathe, there might be if a tiny bit of movement's happening, no big deal. But if you're seeing that, because the force of their breath is all going forward, you really want to teach them to slow the breath down and to stretch it out back through that tight place. It's going to feel like they're not getting as good of a breath because the restriction in the muscles, it's going to make it feel tight. Mm-hmm. And that's good. We want them to feel like, oh, that's a little challenging. And we don't want them to just go into what's easiest for them. Okay. Now, skin rolling is the last thing. Not everyone's going to be comfortable with this, but essentially you take the skin and you just kind of pull it away and you kind of knead it. So I'm doing it through my clothes here and it feels great even through my clothes. But if they really want to get into it, you can put a little oil on your fingers and actually touch the skin. But just for this video, I'm just going to show it through the clothes and then you would do it on the other side. So remember I said the external obliques can get really locked up. And if they're not getting any good movement out there, they might want to just kind of draw that skin away and just kind of loosen it up. And then see if that gives them good breath. Now, some people are just so locked up, they would need more than that, but you don't need more than that to get them started. At that point, they would want to come see someone like me. So note that at first, moms, especially in the first 2 months, may feel nothing for a couple weeks. I've had women really early on feel their pelvic floor right away. And I won't do core work with someone unless they can really feel their pelvic floor. Because how can you control a pelvic floor if you can't feel it? So if you can't feel it, you don't know if you're bearing down or not. Okay, so just emphasize that it doesn't matter if they feel anything, but tell them to keep trying to breathe laterally to get that space going on in the diaphragm, and then tell them not to worry about feeling the back muscles or the pelvic floor muscles. If they're just like, I don't feel anything, just say, okay, then just worry about the lateral breathing and just tell them to breathe deeper than they normally would and just like slowing that breath down, which is going to be great for their stress too. Okay. And eventually they will be able to start to feel everything again, but it does take consistent practice. Okay. So all the ways an exhausted new mom can practice deep breathing and the directive breathing 40 times a day. So do you see the difference? There's just deep breathing, which I'd love to just see moms do as often as possible. They don't have to be perfect, but as often as possible. And then there's the directive breathing, which I'm suggesting you tell your clients to try to do 40 times a day. And the directive breathing is kind of just stopping and focusing. Okay, so that's the 40 times a day, stopping and focusing and holding onto the ribs and making sure they're getting that lateral movement. And then for the rest of the day, they can just kind of try to breathe a little deeper. Okay, so all the ways. So one, if she gets a shower, she can practice doing this 10 to 20 times a day. And if they're pregnant, you know, same thing, try to do the 40 times a day through the back area. And then right when she sets the baby down for a nap, she can do 10 to 20 times of that focused work. And then right after she brushes her teeth, she can focus just real briefly, 10 to 20 times. And then when she sits down to breakfast before she takes a bite, that could be her time. And then when she lays down for bed before she falls asleep, that's when a lot of moms tell me that's when they finally do it. But the point is, the reason why I set these up with specific things that's happening in their lives is if they choose, like, this is my signal to practice. Like, so, oh, I brushed my teeth. Oh, that's my signal to practice. Oh, I'm taking a shower. Okay, that's my signal to practice. Oh, I'm laying down for bed. That's my signal to practice. If we can associate a signal, then we're more likely to keep a habit. Okay, and then the deep breathing, which is a little different than the focus, she can do while she's nursing. She definitely do while she's walking. If you get a woman in better posture and walking, you can help her heal so much better. And then, you know, when she's pushing a shoulder, she can keep those shoulders down and stand tall and do the breathing. And then when she's doing chores, dishes or laundry, while socializing, waiting in line, waiting for a doctor's appointment, while she's driving, you get the picture. She can do it all the time. So there's nothing stopping us from being able to breathe. So if a woman's like, I really want my body back, you know, just be like, well, this is what you can do all day. And they're not going to do it all day. But if they just do it 20% more, 80% more, and the more pain they are in, the more they need to do it, even if it's uncomfortable. So it will really, really help. Okay, so impacting behavior. Let's just take a sip of water. All right. Okay. So this is where it gets interesting when we're impacting behavior, because we can teach all the techniques we want, but they don't really have any power without practice. So we need to get the techniques to stick. And so I mentioned above a little bit about pairing with a signal, which is very, very helpful. So the ultimate responsibility is in the individual, but I think it's our responsibility to remind them of their intrinsic power to do so and to educate them how important this practice is, to just, you know, like, this is the very least every mom should be doing. And, you know, I understand we're all tired. We all have excuses, but I have seen women heal their diastasis from breathing alone. And of course, that's a mild case, but it really, really helps. Okay, so I'm going to just tell a little story here. Okay, so a wise teacher and his pupil were taking a stroll through the forest, and they stopped before a tiny tree. And the teacher says, pull up that sapling. And the teacher instructed his pupil as he pointed to a sapling just coming up from the earth. The youngster pulled it up easily with his fingers. And the teacher said, now pull up that one, and pointed to a more established tree coming up to about knee height on the boy. With a quick yank, the lad pulled it up, the tree roots and all. As he gazed down the way, the teacher said, now this one, said the teacher, nodding to a much more established evergreen as tall as the young boy. And with great effort, throwing all of his strength and weight into the task and using a stick and stone he found to pull and pry up the roots, he evenly got it out of the ground. Now, without rest, the teacher said, I want you to pull up this one. As the pupil followed his teacher's gaze, he found a mighty oak so tall the boy could hardly see the top. And knowing the great struggle he had just had pulling up the much smaller tree, he simply told his teacher, I'm sorry, but I can't. My son, said the teacher. You have just demonstrated the power habits will have over your entire life. So the older they are, the bigger they are, the deeper the roots grow, the harder they are to uproot. Some get so big that the roots go so deep, you might even hesitate to try. So I just wanted to bring that up because it's amazing how hard it is to get one simple habit to stick. And I would really love to see this one little habit stick in women. Okay. So many of us identify as not being able to stick with something. Like we put that on our identity. And those are the people that are hardest to get through. And those are the people that need things like this the most. And that identity is just not true. Think about brushing your teeth. You just have to have a method, understand the true importance of why you are doing something, and then create a time association where you can do it every day, just like brushing your teeth. Once you do it long enough, a habit is created. We have the power to create a habit with anything. So, but like cleaning our teeth, we've been taught over and over and over and how crucial it is. And that's why we stick with it. So my hope is for perinatal providers to just say it over and over and over to new moms so that it sticks. So culturally, a lot of women believe they just go to the doctors and the doctor is going to fix their issues. And if this wasn't true, we wouldn't have so many women doing nothing because the doctor couldn't do anything for them. Perhaps it's because we are so used to giving our personal power away, especially as women. So we need to impact a woman's sense of power. No one can breathe for them except them. And we need to turn on that sense of, oh yeah, the power is in my hands. So number one reason they should practice this breathing technique is a dose of reality and a reminder of their power. If I don't do it, no one is going to do it for me. I am in charge of my body. Number two, this breathing technique is a foundation of recovery for my body. I know that if I breathe laterally and deeply throughout the day and do focused checks 40 times throughout the day to see if I'm breathing, 360 degrees, the connective tissue of my core has a better chance of healing and functioning well. It'll help me relax my pelvic floor and my entire body, and this will help me prevent or at least lessen the severity of multiple birth injuries such as diastasis recti, prolapse, incontinence, and it will help me have a better functioning core when I decide to go back to exercises. It's not everything, but it is the foundation along with reestablishing a good sense of posture, which I can do by walking to a wall and making sure I'm upright more often and frequently throughout the day. So I don't have to be perfect to see improvement. So I haven't talked a lot about posture, but when we are in better posture, we breathe better. So definitely you want to teach that as well, just to teach them to go to the wall, stand up against it, and get taller. Number three, being in my body gives me knowledge about how to care for myself. If I sit and breathe into my discomfort, I will be guided to honor my current state of energy. On the other hand, if I'm unwilling to feel what's going on in my body, I'll be more likely to run myself into the ground unnecessarily. So our pain and discomfort is where the good life is, meaning we can't just walk in this life without any regard for what's going on in ourselves. So if we are willing to be fully with our emotions, then we can make this stick. Sorry.
Can I ask a question?
Pardon?
Can I ask a quick question?
Yes, please.
Any considerations for somebody recovering from a surgical birth?
Just they're going to be in more pain. I would just have them focus on the gentle side lateral breathing. But that's another really good reason to teach them, because if they've had a surgical birth, you certainly want them to get more space this way so that they're not putting all that pressure down. You might want to add in like some kind of like soothing meditation to just remind them that they're safe in their body, or, because we're so tender in those first little areas. So Depending on the person, you might want to have them visualize something that's very comforting for them, because it's not going to be comfortable to breathe deeply, period, right? But it will help them tremendously. So I think of this as like, I remember when I was taught to breathe into my menstrual pain when I was a young girl. And I remember before I was taught it, when I had menstrual pain, it was like this. It's like, just keep me away from that pain. I don't want to feel it. And you retract against it. And then I was taught to breathe into that pain. And my brain was like, are you serious? Because our brain wants to protect us from pain, right? And I remember when I was finally able to do it and I breathed into that pain, I breathed into the, it just slowly rippled the pain out. And I was like, oh, this really works. So, you have to just take that one moment of discomfort and get past it. And then there's just all these benefits from, not retracting and resisting our pain, and I'm sure there's just going to be times when women can't, and that's okay. They can come back to it later. Does that answer your question? Cool. All right. Okay. So another thing is just to ask more questions of your clients. Ask them what motivates them. Are they desiring and motivated to heal their bodies? And if not, they probably aren't going to want to learn a technique, but most women do and are interested in that. So ask them to get clear about what motivates them. Do they want to avoid pain, or do they want to get back in shape? Do they want to heal their core and feel better? Encourage them to say it out loud and write it down on a sticky note so that they have their little motivational sticker. And so what drives them, it's like, oh yeah, I gotta breathe. Okay. So I'm not going to go over this, just all of it, because we're running short on time, but you will have a replay of this. So if you want to kind of come back and read over this, there's some good nuggets in there. Okay. And then B, what are your clients' learning style? I just started doing this with my clients, and it really makes a difference. So are they visual? Are they audio? Are they kinesthetic? It's really important to understand your client's learning style so that you're not just coming from your own personal learning style. So if you can ask questions and get them talking about what makes them tick, and my husband's super audio. He remembers everything he hears, where not for me, I have to experience it, so it's important to know. Okay, so wrapping up. So studies suggest when we get a little education on basic anatomy, if we can see the muscle that we're working with, healing results improve. Directing our breath to tighter places in the body and relaxing areas of tightness impacts the function of our muscles. And we already know it improves stress, but understanding that it can prevent diastasis and prolapse and leaking may motivate your clients a lot more than just impacting their stress. Okay, so we need to make this a practice like brushing our teeth. We need to think about it like, oh, I didn't do my directive breathing. Oh no, my tightness quota. Sorry about that. Let's see. Okay, so we we need to think about it, give them kind of when we brush our teeth, we're worried about bacteria, and we've been taught that over and over. So we will brush our teeth no matter what. So you need to think about oh, my tightness quota is building up, so I better release the tension, or I'm going to have to go visit the chiropractor or the doctor, so it will save them money. So consistency is something we do all the time. We eat meals, we brush our teeth, and we can definitely do directive breathing every day. So I would love to see my clients coming to me already knowing how to do this, so that I don't have to spend so much time with them doing it. It would be really, really cool. So I could there's so many steps that I need to do with them. It would be nice if this one was taken care of, so I could spend time with them doing other things. Okay, so let's not underestimate women. Let's view people as being, I think there's this idea that, oh, people aren't interested in prevention, but I don't think that's true. I think we want to know what we can do to prevent further injury. So I do think that people will be interested in this. So I have a new program coming out in March called the Happy Mama Body Immersion Program. It'll be 12 weeks, and I'll be sending you guys more information on that in the next couple hours. And so if you have, so when I work with people, I work deeply with them, and I really like to work on the transformation of their body and, you know, setting habits. So I'm kind of like a life coach and a postpartum recovery person. And I do a lot of things that pelvic floor PTs do. I don't diagnose things, and I don't do internal work, but I do everything, a lot of pelvic floor release and rehabilitation from the outside. So I do oftentimes will refer out to pelvic floor PTs if someone has something more serious going on. And a lot of times our work combined is really amazing. Okay, so I'm not going to talk too much more about me. You guys have been here and listening, and it's a lot of information on one simple technique, but let's talk. Tell me your questions.
When would you start with this? And how long should someone do this to see the benefits, to begin to see the benefits?
Yeah. Okay. So it's something I keep coming back into my life. So if I feel, let's see, I had a pretty severe recovery load, like everything went wrong with my body. And so I have this old hip injury that if I don't do my regular exercises, and if, like, let's say I get sick for a couple of weeks, my leaking will come back. And so I will jump on this breath like nobody's business. So, and one way, what I'm talking about is it's a tool to use for a lifetime. But in those early periods, what they say is at least 3 weeks to start to notice the real benefits and the effect. Now, some women, if they just do it for 3 days, they can, I mean, just doing it for a day sometimes can change leaking, because if their leaking is from holding tension and they've all of a sudden let go of that tension around the bladder, they can, you know, let the bladder relax. So it can happen in a day, but I say 3 weeks. So if you're going to give like a time frame, like do this for at least 3 weeks. Okay. I think that 3 weeks of it can change the tissue. You can really start to change the tissue. I mean, here's a good thing this is a great question. When you go to like a physical therapist, they will say, do this for at least 2 weeks to start to notice a change, but don't stop then. They'll say you need to do it for at least 2 months to make a lasting change, like in the way that the muscle functions. And I think this is similar. And at the same time, we just need to be breathing more deeply. So I would say within 3 weeks to 2 months, you can really change your relationship to breathing. So try to get them to commit to it for that long. And then once they notice the benefits of doing it for that long, because they will definitely see the benefits after doing it for that long. And if they stop for a while, they'll be like, and things start to tighten up, or they're not breathing as deeply, then they'll be like, oh yeah, when I was breathing deeply, that really helped A, B, and C. But if you could just get them for 3 weeks to 2 months of doing this, at least you will affect that pattern that's set in. So remember I said the pattern from pregnancy is that the diaphragm stops moving in its range of motion because it can't. There's no physically human possible way you can get the diaphragm moving in its full range of motions at the end of that pregnancy and that last trimester especially. So that is a habit that is going to stick unless they do something to get out of it. So if you can impart this wisdom for 3 weeks to 2 months, you can shift that. And so maybe because you did that from now on, they won't have that compacted, shallow breathing pattern. So you're doing them a huge service.
Thank you.
Yeah. Any other questions?
Not from me.
Great. So there will be a replay, and I'm so glad you are here. This is just the start. You guys just did my first webinar. Thank you for being my guinea pigs. Yeah, and I really think this information is so valuable.
Thank you, Jeannie. It was nice to meet you.
It was good to meet you too, Sarah. Good to meet you, Kim.
You too.
Thanks for being here. Okay. Have a great day, guys.
Okay, you too.
Okay. Bye-bye.
Bye-bye.